Hi class, my name is Sevada Minassians, and I will be presenting on the disease Proliferative Diabetic Retinopathy. So what is diabetic retinopathy? We know in general that diabetes is a very crucial, life-threatening disease based on the control of blood sugar in the body. These patients are considered candidates for possibly having retinopathy, which is the diabetic disease in the eyes. This disease occurs in the retina of the eye, which projects vision and includes another part of the eye called the macula, which allows for central vision, as we learned in chapter 16. There are two stages to this disease. The early stage is called non-proliferative diabetic retinopathy, where blood vessels in the retina are becoming weak and may cause leaking. Blood leakage causes macular edema, leading to possible vision loss. The more advanced stage is called proliferative diabetic retinopathy, where neovascularization occurs, forming new blood vessels where the weakened blood vessels in the earlier stage need compromise. Leakage in this stage can cause complete vision loss very rapidly. Symptoms for this disease include floaters, blurriness in vision as shown in the video to the right, impaired color in vision, and complete blindness. There are complications that can occur with this disease. Vitreous hemorrhages can occur, resulting in the symptom of seeing floaters. The blood vessels can bleed in the jelly that fills the eye, called the vitreous, projecting floaters in the vision. Another complication that can occur is retinal detachment due to the swelling that occurs. This separates the retina from the back of the eye, causing severe vision loss or even complete blindness. Finally, another complication that can occur is glaucoma, where there is an elevation of eye pressure causing damage to the optic nerve and eventually generating vision loss. To test for proliferative diabetic retinopathy, there are 3 different types of photography that allow for analysis of the disease. One type of photography is called a fundus photo. An example is shown to the right. This photo shows red spots that are called microaneurysms. These microaneurysms are what cause leakage. A different type of photography is called fluorescein angiogram. This photography requires an injection of a dye into the vein called fluorescein, which brightens the blood vessels of the eye. Once the dye is injected, the video on the left shows how the vessels become more visible, allowing detection of leakages and newly formed vessels. Another type of photography done is called the optical coherence tomography, or OCT macular. Shown in this video is the photo being taken. As you can see, the retinal layers are all smooth and intact in this video while the scan is happening. If there was any macular edema, the photo up here shows what the retina looks like with swelling occurring. There are 2 main treatments for this disease. One is called an intravitreal or IVA injection. Anti-angiogenic medications such as Avastin serve the purpose to stop blood vessel growth, as we learned in the Can We Eat to Starve Cancer video. This medication is injected through the sclera of the eye as shown in the photo here. The other main treatment is called panretinal photocoagulation laser. Burn marks are made to the newly formed vessels, allowing the vessels to shrink. This fundus photo shows the laser marks post-treatment. Another type of treatment that I have listed is corticosteroids, but this is not often used. The corticosteroid is either injected or implanted. For temporary use, Ozurdex is implanted. For long-term use, Iluvien is implanted. But consequences such as cataracts or glaucoma are at higher risk with corticosteroid implants. Proliferative diabetic retinopathy is a complicated disease to treat due to its advanced stage. In my work experience, I work with these patients daily, and taking this course has really helped me understand a lot of the vocabulary used in the medical field. I try to use the knowledge of what I'm learning in class to answer patients about questions they have in simpler terms. I've learned so much from this class and will implement my increased knowledge in my future endeavor to become a PA. Thank you.